Did you know a condition that starts during pregnancy but can lead to seizure, organ failure, or even death if left untreated? It is called pre-eclampsia and it affects millions of mothers worldwide. Pre-eclampsia is a pregnancy-specific disorder which is characterized by new-onset high blood pressure and protein in the urine occurring after 20 weeks of gestation. It can sometimes be accompanied by signs of organ dysfunction and can occur after pregnancy. If left untreated, pre-eclampsia can develop to eclampsia, which would involve seizures and can be life-threatening. Pre-eclampsia affects about 2 to 8% of pregnancies worldwide. This means that in every 100 pregnancies, about 2 to 8 of these pregnancies will result in pre-eclampsia. This is an average range as prevalence varies across regions, access to healthcare, and individual risk factors. Several risk factors can increase the risk of developing pre-eclampsia, and these include first pregnancy, especially over the age of 45, multiple pregnancy, that is being pregnant with twins or triplets, obesity or having a BMI over 35, family history of pre-eclampsia, having pre-existing medical conditions such as type 2 diabetes, hypertension, or kidney disease, and finally having an autoimmune condition such as antiphospholipid syndrome or systemic lupus erythematosus. Having a risk factor doesn't always mean that pre-eclampsia would occur, but closer medical supervision is recommended beyond routine screening, and this would depend if your risk is low, moderate, or high. Common symptoms of pre-eclampsia would include persistent high blood pressure, protein in the urine, severe headaches, changes in your vision such as blurry vision, seeing spots, or flashing lights, upper abdominal pain, constant nausea and vomiting, especially after the first trimester, and finally, swelling in your hands and your face. While some women may experience a range of noticeable symptoms, other women may remain without symptoms. That is why it is really important to attend your antenatal appointment as soon as you become pregnant, as some of these symptoms can be picked during your routine screening. While there is no guaranteed way to prevent preeclampsia, certain strategies can help lower the risk. Preventive measures will focus on regular antenatal care to monitor and pick up early signs of preeclampsia, and this would include checking your blood pressure at every antenatal appointment and making sure that you have a target blood pressure levels, especially if you're known to have hypertension. Number 2, it is important that your urine sample is checked at every antenatal visit to ensure that there is no protein in your urine. If you have a pre-existing medical condition, please consult with a specialist before falling pregnant. Depending on where you live, you can attend pre-pregnancy counseling. Your specialist will check if your condition is stable enough for you to consider pregnancy. They would also review your current medications to make sure if they are suitable for you when you do fall pregnant. The treatment and management of preeclampsia depend on the severity of the condition and the gestational age of the pregnancy. The goal would be to prevent complication and have the best possible outcome for both the mother and the pregnancy. Determining when to end the pregnancy and deliver the baby is critical for treating preeclampsia, and that decision will be made by your healthcare provider. If you have found this content particularly useful, do consider liking this video and subscribing to this channel for more educational content. If there is any topic that you would want me to discuss, consider leaving it in the comment section below. Thank you for watching, and I'll see you in my next video. Bye for now.